بسم الله الرحمن الرحيم. أبناء الطلاب وزملائي أطباء الدراسات العليا، يسعدني أن أقدم لكم هذه الأفلام التعليمية التي تتناول الجانب العملي لمادة التشريح. فلنشاهد الآن هذا الشريط على أمل أن يحقق الفائدة المرجوة منه مع تمنياتي لكم بالتوفيق. يقول الله تعالى: وقل اعملوا فسيرى الله عملكم ورسوله والمؤمنون. صدق الله العظيم.
This is the back of the thigh. This is the long head of biceps femoris muscle. Notice its origin from the ischial tibulosity in common with the origin of the semitendinosus muscle. This is the origin of the semitendinosus. Notice that the long head of biceps crosses obliquely in the back of the thigh from medial to lateral, over the sciatic nerve. Here, the sciatic nerve runs vertically between the long head of biceps and adductor magnus muscles. Following the long head of biceps laterally and downwards, it leads to the short head of the same muscle, where both heads join. This is the short head of biceps femoris. It is thinner and short, and on its lateral side lies the strong lateral intermuscular septum, which separates it from the vastus lateralis muscle. This lateral intermuscular septum extends from the deep aspect of the iliotibial tract deeply to the linea astra. The long head of biceps gets its nerve supply from the medial side of the sciatic nerve, while the short head gets its supply from the lateral side of the nerve. The biceps femoris is flexor and lateral rotator of the leg. This is the tendon of insertion of the muscle to the head of the fibula. It overlies the fibular collateral ligament. It forms the upper lateral boundary of the popliteal fossa. This is the fibular collateral ligament deep to the tendon of the biceps. Notice that the common peroneal nerve runs along the medial border of this tendon on its way to the back of the head of the fibula. This is the head of fibula. This is the common peroneal nerve. This is the semitendinosus muscle. It is thus called because its distal half is tendinous while its proximal half is fleshy. You can see its long tendinous part. Notice that it arises in common with the long head of biceps and that it lies over the semimembranosus muscle. It gets its nerve supply from the medial side of the sciatic nerve. This is its nerve supply. The tendon of the semitendinosus muscle runs on the medial side of the back of the thigh to form the upper medial boundary of the popliteal fossa, together with the semimembranosus and the tendon of adductor magnus muscle. This is the semimembranosus muscle. It lies deeper to the semitendinosus. It is fleshy below, but membranous above, which is the reverse of the semitendinosus. This is the membranous upper part of the muscle, which is so extensive that the muscle is called semimembranosus. It takes its nerve supply from the medial side of the sciatic nerve. It is now clear that the three hamstring muscles arise from the ischial tuberosity. This is the long head of biceps. This is the semitendinosus combined with the biceps. This is the semimembranosus. The tendons of insertion of these three muscles run downwards to bound the popliteal fossa. This is the adductor magnus muscle. It lies deep to the hamstring muscles. Here is its upper border, which lies edge to edge with the quadratus femoris. The sciatic nerve runs downwards over its surface, and it is perforated by the perforating arteries of the profunda femoris. These are the perforating arteries. Note that the adductor magnus is formed of a pubic part attached to the side of the pubic arch and an ischial part attached to the ischial tuberosity. This is the ischial part. Notice that the upper fibers of the muscle have a horizontal direction, but its lower fibers become progressively oblique to end below in the adductor tubercle. The muscle is inserted along a line extending from the gluteal tuberosity, the linea aspera, the medial supracondyle line, and ending into the adductor tubercle. This is the tendon of the muscle which leads to the adductor tubercle. The muscle is perforated by the femoral vessels to become the popliteal vessels. These are the popliteal vessels, and this is the opening in the adductor magnus, which transmits the femoral vessels. The adductor magnus acts as a fleshy septum on the medial side of the thigh, separating the other adductor muscles in front of it from the hamstrings behind it. The cruciate anastomosis lies on its upper part. This is formed by four branches. First, the inferior gluteal artery from above, which is a branch of the internal iliac artery. Second, one of the perforating arteries from below. It comes from the profunda femoris. Thirdly, the medial circumflex femoral comes from the medial side. It is a branch of the profunda. Fourthly, the lateral circumflex femoral comes from the lateral side. It is a branch of the profunda. So, this anastomosis communicates the internal iliac artery with the femoral artery just below the inguinal ligament. This is the medial circumflex artery. emerging at the upper border of the muscle. This is the sciatic nerve. It descends deep to the long head of the biceps and gives off branches to the biceps femoris, to the semimembranosus and to the semimembranosus muscles. It ends below by dividing into two main divisions, the common peroneal and the tibial nerves. The common peroneal runs downwards and laterally along the medial border of the tendon of the biceps femoris, while the tibial nerve descends vertically in the midline.